All right, next is Randy Lambrecht. He is Vice President, Research and Academic Relations, Aurora Health Care. And this will be on the development of 3D mapping technology at Aurora Health Systems, an overview of the Wisconsin Medical Entrepreneurship Foundation.
It's a mouthful. Thank you, Lisa.
I'm just going to grab mine.
Well, I'm really pleased to be here, and thank you all for being here. I want to thank Worf and WISES. I'm going to break my talk just into 4 one-minute little comments. One, I'll tell you a little bit about Aurora if you don't know it. I want to then branch off into our cardiovascular area, which is a big part of what we do. Talk a little bit about our relationship with WISMEF, and then I'll focus in on the project that we're working collaboratively on. So if you don't know, Aurora is this little healthcare system along the east coast of Wisconsin. It's actually one of the largest healthcare systems in the country, the largest private employer in Wisconsin, a $4 billion organization. We see 3 million patients a year, 15 hospital medical centers, 155 clinics, one of the largest diagnostic reference lab with advocate system in Illinois. The point that I'm trying to make there is we see a lot of patients, we have a lot of volume, and that gives us a lot of opportunity in terms of our electronic health record, which we've had for a very long time, and our biorepository, where we've collected DNA samples over the last 5 years. We have one of the largest biorepositories that are then linked to that medical record. So if you didn't see the poster, that Dr. Vani Nilikantan, who's the director of our investigator-initiated research out there, it's still out there, but it's an opportunity for us to partner with a lot of different folks. So Aurora is very large, and one of our major efforts, or what we're known for, especially at our flagship hospital in Milwaukee, is our cardiovascular unit. And I just pulled off before I came here. I would have had slides, but I was going to make those slides this morning. I got caught with a physician at 6 o'clock in the morning around an issue before they go into surgery. That's the way it happened, so I never got my slides. Sorry, Lisa. But some of the procedures that we've done this past year, over 10,000 cardiac ablations. That's a lot. Over 1,000 valve replacements and repair. We have a clinical trial right now where we can replace the aortic valve without cracking open the chest. It's called a transcatheter core valve study. Little pig valve tucked in a catheter. The pig valve is sewn to a stent, tucked in a catheter. Catheter is threaded up through the artery, deployed where the old aortic valve is. Catheter is withdrawn. They've got a new aortic valve. Only one in the state doing that, 30 patients, and it's amazing how these patients, no mortality, and their quality of life has improved. We've put in about 5,000 stents, over 10,000 catheters, 4,000 electrophysiology studies, 50 heart transplants. I could go on and on, but about 35,000 invasive cardiac procedures. So that leads us then to the problem that presented us, not problem, an opportunity, with one of our interventional cardiologists who said, we could do a much better job in cardiac arrhythmias or atrial fibrillation if we could, when we try to ablate a piece of the heart tissue to get the heart beating more normally, if we could visualize that catheter in the heart chamber a little bit better. He had been working on this for a very, very long time and just needed some more help and some more expertise. So the opportunity to work through WISMEF with WISES and also our friends at Baycare and Marshall Clinic allowed us to take some funds and surround him with expertise that's in the UW system to move this project forward. Probably couldn't have done it, or the project would have gone on, but it would have taken a number of years longer. So what the project entails then is it's a 3D mapping of the heart chamber. If you can imagine trying to visualize a catheter in the heart chamber, and the catheter is there to ablate some tissue. The heart's beating, the chamber volume's moving, and quite frankly, if you're using typical fluoroscopy, where you're visualizing the catheter in the chamber, it's hard to make the catheter out with some of the other tissues there. So it's not a very exact procedure. You can use radiologic techniques X-ray, computed tomography, cardiac magnetic resonance imaging. But all of those have their own dangers, and quite frankly, you can't do that unless you're a medical center or a pretty large institution. So one of the things we had in the back of our mind is we'd like to be able to do cardiac ablations almost anywhere in the world, not just in major medical centers. So how do you do that? If the equipment that's out there now that's available is very expensive, not very mobile, or if the fluoroscopy method just gives you an XY, a single plane to look at, doesn't give you that three-dimensional. So what this project is a way to take single plane fluoroscopy and use techniques to do three-dimensional imaging in a beating heart. And we have a fairly good animal study going on now to do that, and we hope to have the rest of it done in a couple years. So thank you very much.